terms of pulling in sector stakeholders to support them in terms of reaching out to farmers and perhaps bridging the gap in terms of making this county be food rich. We've had about 3 stakeholders within our team under the patronage of the Department of Agriculture. And we're just doing an overview over what these sector stakeholders have been doing in this county. I'll start with KTD here, who are doing a tremendous job. I've had a presentation of about 3 managers from 3 different tea factories. I want to highlight the value in terms of infrastructure, which they've highly improved within this county. I think making access roads in terms of the very farming zones, or let me call them the T zones, right? That are making the logistics around the quotation of tea, perhaps in terms of processing, and also supporting farmers access those very areas. So far, we've been working with about 200,000 farmers, issuing them loans at an interest of about 60%, which I believe is very low and very appealing. Farmers, they also provide insurance with very affordable premiums. They also offer medical wellness to about, tune of about, I think 35 shillings to around 230 shillings, which is very affordable for farmers where they can easily be admitted with hospital around, get all the services in terms of medical procedures and perhaps even outpatient services. In terms of agriculture, we also have 3 nurseries attached to most areas of variety, and through these 3 nurseries, they're able to issue out seedlings on, fruit-free seedlings. They're able to offer, we see a lot of wood trees. They've also been very much supporting the county in terms of conducting CSR services, where they partner with the county to conduct a medical camp, and they've been actually all successful across various counties within the county. In terms of agroforestry program, they support farmers with free tree seedlings, and they've also supported their neighboring communities around the factories with free water supply, just to enhance their livelihoods. They also have, or they offer attachment to students. They support with buying back firewood from these various communities. So in as much as they are promoting agroforestry, you can see the value and in terms of return value, where through those trees they buy them back and use them in terms of just like processing up with the tea. They also offer extension services through their programs, where they have officers who help improve extension services within the local localities. They issue subsidy fertilizer. That's a good one to at least. And then we had another stakeholder by the name of ADS. ADS is like SEK Development Service. I guess nobody knew SEK also has such services in the agricultural sector, so they also have a support service in terms of agriculture. They operate in 2 wards within Nyamira, that is Bogichora, where they serve over 840 farmers, clustered in about 46 groups each. They'll be working with farmers perhaps in terms of issues of inputs, where they give the tissue catch bananas, supply with the napier, seedlings for dairy farmers, and then they also offer tubes. I've just forgotten, I did not indicate that, but I believe those are banana tubes or something. Yeah, and then the operating in Siso ward also having about 780 farmers clustered in 60 groups. What essentially they do is also they have mentor farmers, and these mentor farmers, the better way to understand these are actually extension officers who support with, inputting that value of agriculture, and perhaps also training people on agronomy extension works. They train people also in entrepreneurship, where they also impact them in terms of knowing how to manage their money, table banking, and savings also for education. With one from them, they intend perhaps to expand to other wards. I believe they're still young within the area, but they promise that they want to spread their tentacles across several wards within the county, just to promote agriculture.
Now, is also
I
part
think this year they spent about 12.5 million
vision
in
entails.
terms of inputs, just
So,
reaching out to
just
farmers
briefly,
within those wards,
Nyamira
and perhaps targeting to have more come next year in terms of their budget, annual budget appropriations for this specific county, and perhaps also in terms of expansion works. The good thing, they'll be working also very closely with the Ministry of Agriculture in terms of extension services, where they work with the WOWs from the ward level all the way up to the CC level. I'll give a snapshot of Tupande, 1 acre flat. Tupande is also a governmental organization serving farmers, particularly we target smallholder farmers within the county. We operate in all the sub-counties within Nyamira County, with a total of about 11 zones. I believe most of us must have seen some yellow containers placed at strategic places, maybe all the way from Kisumu, all the way in Kisii, all the way in Nyamira, Bomet and other regions. So these, we call them 1 acre flat Lucas. Actually, they are more like an agrovet, a one-stop shop where you go, you get all the values of inputs, fertilizer, seeds, lifestyle goods like solar lights. We have other agricultural inputs like wheelbarrows and the rest, where we serve, we call them our core clients who are enrolled with us and having a year payment period of 1 year, where they pay inputs in loans. So we don't give cash loans, but we give them in form of inputs. Yeah, so within these, we call them the impact zones. Within these specific impact zones, they are spread across all the sub-counties within Nyamira. I'm not really in the interest of time, not want to mention all of them, but I believe we see most of them. We injected about 153 million last year. We are yet to do the estimates of this year, which might be a bit higher. These are actually loans that are injected directly through core program clients. And that means the working clients will just go there, buy fertilizer, buy seeds. We will not yet account it, but it is in terms of hundreds of thousands. And that will mean in terms of revenue generation, perhaps that we raise maybe through those Lucas and inject back again in terms of expansion will be in extremes of over 100 million. So in terms of revenue, for the compliance of these Lucas alone, the revenue that we pay in terms of compliance, that is to have all the licensing and all that done, we injected over 500,000 Kenya shillings. And what we actually planning is that we want to continue complementing our services with the Ministry of Agriculture in partnerships. And that is what actually we with all the stakeholders within the same field. That if you will be very keen enough, all these teams offer extension services. And that is highly where we want to come and meet the gap, support them. And beyond that, also just to plan for another sector meeting where we need to bring our thoughts together on how much we can empower the team and support the Department of Agriculture. Thank you so much.
Well, that has a lot to say with this, and the most important thing, I think, for us as health, it was quite a very important meeting for us to have. All I can say is that we ran short of time because interesting things from different people, but we hope to have another meeting nonetheless. We talked about, Waziri gave us a preamble about what has been happening in the health sector and some of our key priorities. More importantly, he understated the importance of stakeholder engagement, which I think all the partners agreed that it was quite important and it was quite impressive. That this was a new dawn, in the sense that we are talking to each other, we are not talking at each other. More importantly, we talked about the 20,000 or close to 22,000 women who we have in Nyamira who are actually supposed to be here. But you find that our facilities only receive 14,000, which gives us a gap of around 8,000. He spoke about very passionate issues which are found in this region, issues of gender-based violence, more importantly and more specifically in terms of FGM, which is being perpetuated by probably our healthcare workers and also some non-health allied workers. He underscored that very well. And we also talked about issues of partner violence, and that comes to SCTV. registration of our health facilities and ensuring that our populace is also registered to ensure that we have more coverage and at least the people of Nyamira are able to enjoy the services. I quickly move to the contribution from the partners. KMET applauded the stakeholder engagements that we have. They talked about how we should target our approaches. One of the targeted approaches they talked about is how we can ensure that we have a joint work plan with all the partners in those sectors. Another thing that they talked about was ensuring that we inculcate issues of quality in all that we do in terms of healthcare, all our programs. And she further affirmed that it would be important for us to have something like a master plan where we do joint work plan. We quickly moved to PATH. PATH also talked about issues of costed work plans. Now each partner who chips in needs to know the value of their money, which still resonates with what Waziri was talking about when he talked about the culture change. He underpinned the importance of sector working groups and ensuring those strict timelines. And in that, we call upon the Department of Finance to actually be releasing that budget circular as soon as possible so that we have those timelines with us in good time. He also stressed the fact that we should have strict timelines and guidelines for having that sector working group in terms of the composition. And we all agreed that each non-state actor should be part of that because it is an all-inclusive government. In terms of SHA also gave us good contributions in terms of what we need to hear. What we need to hear first is from SHA was about registration. They told us about how they'd like to do their registration, and they faced it in 3 prongs in terms of zoning, in terms of publicity, and in terms of partnerships. The conclusion of that is that on Monday we are going to be having a meeting with them, and so we are going to discuss those areas further. In terms of meds, I think what they told us, which was quite critical, and for us, it's something which is quite big, now that we're going to be having the revolving drug financing, is issues of credit. Most people don't like extending credit to county governments, but at least in them now we have those 60 days of credit, which I think we really appreciate. Thank you very much, Meds. TICO, very important. I think one of the bills that touches the heart of the health sector, which is the FIF bill. I think we shall call upon you to also sponsor it a bit to ensure that it goes through the stages of the county assembly. And that will be important for us. We really look forward to working with you. We have so many other partners. Some of them could not express themselves, but we are sure in spirit we are in the right area. Thank you very much.